display readiness for performing the procedure. And then display for show for enthusiasm and interest for performing the procedure. Then display constitutes the effort to correct mistakes and employees reliability and confidence of performing the procedure and ensure the personality.
And bend elbow, and then make sure that your other hand is on the other side of your cheek or cheek. Then next is to bend the knee.
Next
So this is important in regards to allowing the patient
First is gonna ensure safety of the patients and the rescuer. Then position yourself by kneeling on one side of the shoulder and the chest of the patient. Then tap the patient's shoulder saying, "Hey, Amy, are you okay? Hey, Amy, are you okay, sir? Are you okay, sir?" Then if the patient doesn't respond, then proceed to the next step. But follow the crowd for assistance and ask others to call an ambulance. Then position the patient on a flat and hard surface.
So first, after performing my
The next is listen the breath of the patient until the head of the patient.
first step is
Feel the patient for opening airway and listen the breath for 10 seconds.
enthusiasm and interest, and then having professionalism, reliability, and confidence, and lastly, being able to answer the rational quiz. So now I'll proceed. So first, I will ensure
Next.
safetyness of the rescuer and the client, and make sure that the area we're in is safe.
The next is
Next,
heel.
I'll be
Place the
kneeling
heel of the non-dominant hand of the center of the sternum and place the dominant hand of the over the non-dominant
I
hand.
will now proceed
Then
tapping my patient's shoulders and checking their
wait for
consciousness.
center the weight of the
Hey, are you
center the
okay?
weight of the
Hey, are you okay? Hey, are you okay?
center the weight of the
So after that,
weight of the hands and then
after that,
perform chest compression.
after that, I will now call
Push
assistance
down
to be able to call the ambulance
push down in the
from
patient's
with
chest
proper
and then
description.
and in a deep
Sir, with a white
2
uniform,
inches.
can you please call the ambulance?
And then ensure approximately recoil, chest
After
recoil
that, I will now proceed
and
to listen to my
using
patient's breath for
chest recoil.
sorry. I'll position my
Then,
surface in a hard,
Give 30
hard, flat ground.
compression, chest compression.
and then I'll now proceed to
for
listen to the patient's breath for 10 seconds.
push hard and not too fast and not too fast.
And also palpating the pulse. If there is no presence of pulsation and if the patient is not conscious, we can now proceed to the chest compression. So for the chest compressions, we'll be putting our non-dominant hand under our dominant hand, and then make sure when you compress it is 2 inches deep. And then make sure to have 2 compressions each second. So
Next
we'll now
is,
proceed to doing the 30 compressions.
After the 30 compression, feel the head of the patient gently and lift the chin and pinch the nose and also seal the patient over the patient's mouth. Then blow air.
After doing the 30
firmly for
We'll now proceed to giving our
1
patients
minute and observe the chest. Observe
Now
the
we
chest
go to the
right.
head, and then lifting the chin forward, and then pressing there, pinching your nose for 1 second.
Next is, and then after I repeat the 30 cycles. Repeat the 30 cycles.
We'll now
Repeat the cycles. Repeat the cycles. The compressions to rescue breath and for 5
and if
cycles
our patient is
and
not conscious, we'll repeat the cycle again.
check the
Another 4 cycles.
check the pulsation.
Equals to 5.
If the patient is
Performing 5 cycles each, and then
pulsation.
after that, if our patient hasn't regained any
If the
consciousness,
patient is
we'll then be continuing the
Patient
compressions
can,
until help arrives or until
if
our
the patient
patient
can without pulse,
has
is gonna continue
consciousness again.
CPR
So,
until the help is arrived. Then
if our
for
patient
the patient
recovers,
can recover.
we will now
Next
proceed to
is-
putting our patient in the recovery position.
Then if the patient
So,
is
for the
gonna
recovery position,
conscious,
we
the
placing the left arm
nanosecond
up,
the body
and
recovers
the
from
right
consciousness
arm across the
position
chest
the
with
patient
the back of the hand
like
below the cheek, and with the
left side of the arm,
with the
left side
right
of the
leg
arm,
also flexed,
raise
so the
and
other one lays
then
flat on the
bend the
surface.
elbow.
We'll
And the
also
palm facing
turn the
facing
patient
and then
position
next is
facing us, and
across
then making
the
sure their chin is adjusted for the airflow.
for knee and flex knee for flex knee on the top.
So the airflow will be
Flex knee on the side of the foot flat surface.
So for the airflow, we'll make sure that the chin is open, so our patient will have the aspiration,
For our patient, if
and then they can also
yung saliva is
from their
mostly or
proper breathing.
then the patients
Position ka wala. Position the patient ka.
yes
Na position siya.
Sir, na-position siya, sir.